When we do SRS, we not only like to follow the standards of care, and we like to have them on hormones for at least a year before, and most people, not all, but most people should be living at least a year in their desired gender before we do the bottom surgery. And the only thing to get ready for the bottom surgery is that I like to have people in good health. I don't like to see them extremely overweight or underweight. I just want somebody to be healthy. Because if you're very underweight, you're malnourished. You won't heal well. If you're very overweight, you won't heal well either. You have increased chance for infection, for bad scarring, for poor results and complications. So it's good to be at least close to your ideal weight. You don't have to be exactly, but at least close, and be in fairly good health. If you have some medical problems, we like a doctor to take care of them first. If you've got some heart trouble or liver trouble or whatever trouble you have diabetes or high blood pressure, they have to be under control. You know, if you've had heart trouble, you had a heart attack, you know, we can do people who have heart attacks. I've done them. But we make sure that they're under the care of a cardiologist, that they're stable, and that they're on whatever medicines they need so we can do it safely. I don't want it on my conscience to hurt somebody. You have to do the operation safely, or else you're never going to be happy with the results if you don't get through the operation alive, for sure, if you come out the cardiac cripple. Now, one of the things we like to do before surgery is in male to female SRS or GRS, one thing I request is that the person have either electrolysis or laser hair removal from the skin of the scrotum. That's the only place that's really important, because in most patients we take that skin and we add it to the penile skin to lengthen the skin tube that's going to be inverted and line the vagina. Sometimes people don't get that done. They either can't afford it or they just haven't gotten around to it, or whatever the set of circumstances is, they haven't done it well. At the time of surgery, we do electrolysis on that skin from the deep surface of the skin. We cauterize all the hair follicles that we can see in order to get rid of the hair. The problem is that hair grows in phases. There's a resting phase, there's a growth phase, and if the hair follicles happen to be in a resting phase at that time, and there's about a third of them are always in the resting phase, about a third of them are growing, then you don't even see, we can't even see those hair follicles. And so they grow later, so you'll have some hair deep in the vagina. Luckily, that hair doesn't usually create a problem. They're so short, and as long as you douche once or twice a week to just rinse out the vagina, because sometimes the skin that sloughs off constantly, remember it's skin. It's not natal vaginal mucosa. Mucosa is the same as a lining in your mouth or inside of your bladder or in a natal vagina. We place skin from the outside of the penis and the scrotum inverted inside the vagina to be the lining of that skin tube. So the skin always sloughs a little bit. You know, if you didn't wash behind your ears, or your kids don't wash behind their ears for a week or 2 weeks at a time, you get a little white goop. It's just dead, sloughing epithelium. It's the superficial aspect of the skin. So we have to rinse that off and wash behind the ears once in a while. We also have to just rinse out the vagina once. It's like washing your hands off once in a while. So I recommend after surgery, immediately after surgery, about every other day, every 2-3 days, we douche out the vagina. Douche is just a shower. After the initial healing of a couple, 2-3 months, I recommend that the patients, for the rest of their lives, just take a douche once or twice a week. It just gets rid of that dead skin stuff, and gunk doesn't pile up in there and get tangled in the hairs, and it just keeps it clean. And other than that, the hair is no problem.